Thank you. Welcome to the Technical Assistant Network for Children's Behavioral Health, Cultural and Linguistic Competence Learning Community Roundtable and Office Hours. Our Roundtable office hours are designed to give you an opportunity to discuss topics of importance to the area of behavioral health equity and cultural competence. The TA Network, as it is known, is part of the National Training and Technical Assistance Center for Children's Behavioral Health for the Substance Abuse and Mental Health Services Administration, commonly referred to as SAMHSA. My name is Catalina Booth, and I'm the Executive Director of the Center for Community Learning and a member of the Cultural and Linguistic Competence Team of the TA Network. Today's Roundtable office hours will focus on advancing behavioral health equity, reflecting on the past, learning from the present, and fostering connections. First, we will discuss the current state of behavioral health equity and CLC practice in systems of care and our communities in general, and we will present preliminary findings of an environmental scan. Next, we'll discuss ways to move this work forward in light of current events and the movement towards improved racial justice and the reduction of disparities in vulnerable populations. And finally, we will talk about the future, including the future of our learning community and how we can continue to connect beyond this format. I'm excited to welcome the experts that will be leading this important discussion today. First, we will hear from Linda Callejas. She is a research assistant professor at the University of South Florida. Then we will hear from Selena Webster-Bass, the CEO of Voices Institute, which is a training and consulting group focused on well-being, multicultural consciousness, and health equity. Selena has 20 years of community health experience and is a core partner of the CLC Technical Systems team of the TA Network. And her work focuses primarily on urban behavioral health, faith-based engagement, multicultural outreach, and organizational, cultural, and linguistic competence. And I neglected to mention that Linda is also the lead of the cultural and linguistic team for the TA Network. And with that, I'll turn it over to Linda.
Great, thank you, Catalina and Selena, and thank you to all of you for joining us on the Roundtable office hours this month. Just to start off with, I wanted to do a quick reflection on the past, given our presentation title and the introduction that Catalina just did. And, you know, I wanted to note that the technical assistance team that focuses on cultural and linguistic competence and behavioral health equity has been working to support the TA needs of system of care states, tribes, communities, and territories for going on 5 years now. And that our work has really focused on promoting, I think, behavioral health equity broadly and cultural and linguistic competence specifically. And I make that distinction because I think it's important to do so, given the definitions for some of those terms, which we've talked about in some of the webinars and other office hours and presentations that we've done in our work, and which I'll touch on briefly. But I think it's important to kind of note, given the present moment, the importance of thinking about behavioral health equity broadly and what it means for communities that face inequities and disparities. So one of the things that I always try to start with when I do presentations or discussions around these topics is to note that while the United States is indeed growing in terms of cultural diversity, this country's always been pretty much a diverse country, right? And not only that, we've also had a history of health disparities that have been documented for going on a century in some communities. So these are topics that have been with us and issues and problems that have been with us for a very long time, right? And I think it's important to acknowledge that so that we can really think about what the causes are, right? When we talk about cultural and linguistic competence, and we think about the definition that was set forth by Terry Cross and colleagues in the 1980s, there is this recognition of the underlying social factors that cause disparities, the need for cultural and linguistic competence. But as research has continued and practitioners have documented disparities in a wide variety of areas, I think the discussion around disparities and health equity has really taken on its own life, and it's really important to focus on. So when we talk about the research on behavioral health equity, I think it's important to really think about these and disparities in particular as social inequities, right? And that is what the research continues to show us, that disparities are a symptom of social inequities to a large extent. And that if we are really to tackle some of these, we really have to get beyond interventions like training, which we often focus on, which are very important, but that don't necessarily touch on these inequities on a larger scale in communities, right? So essentially, when we look at health disparities, we're really looking in essence at symptoms of inequities, as I said, that are rooted in unequal distribution of resources to particular communities, right? So these are relationships that exist outside of the organizations in which we work and the systems of care that we work with. But that we really kind of see systems of care, children's mental health systems and adult mental health systems, particularly public systems, are among the first to see these inequities and the results of these inequities, right? When we look at mental illness, substance use, and other issues, for instance, in juvenile justice or child welfare systems. And then cultural and linguistic competence, I think we focus on looking internally at organizations to look at some of the infrastructure and other strategies that organizations can actually implement in very specific ways in order to address the specific needs of particular populations that are seeking services from our systems. And before I move into the preliminary results of our environmental scan, I wanted to note that a lot of the technical assistance that we have done, particularly in the last couple of years, has focused on the national class standards, right? And that there has been, the national class standards are sort of a hallmark of a lot of efforts on the part of federal agencies to address the needs of very specific populations that have been documented over time as having disparities, and not just racial and ethnic disparities. We're talking about disparities with regards to disabilities, with regards to LGBTQ populations. And so I won't go into the class standards in much depth, and Selena will touch on them, I think, in her portion, but it's important to note that the class standards serve as a good framework for organizations to really think about their infrastructure and how they're set up in order to address the needs of communities that are experiencing these inequities and the disparities that result from them. So I want to also encourage folks, I know that we're using the chat, so if you have any questions or you need me to slow down or present, something again, please let me know. And I think we have a hand raise option on the WebEx. So one of the things that I wanted to talk about today in particular, moving forward to the present, is an environmental scan that the technical assistance team undertook and is really still in process. It's a questionnaire that we sent out to systems of care that we've worked with in the past in order to get a sense from them what are the breadth of practices and strategies that they're using to promote behavioral health equity and cultural and linguistic competence. And the scan itself has about 25 questions, give or take, with some additional prompts. And so we, we piloted it with a few folks that we've worked with extensively, and then sent it out by email. And we're hoping to continue to get responses to the environmental scan because we're hoping that it gives us a good reflection of the trends with regards to these practices, right? And with regards to what we might need to do to better provide technical assistance that's focused on the needs of systems of care around the country. The other thing that I wanted to note is that, particularly in this time, I didn't say this with regards to the past, but we've been living through a time where we know that there are really stark disparities around COVID-19. There are communities that are experiencing, inordinate rates of infection, and these are, Black communities, Latinx communities, some Native communities, as well as poor populations or families that live in, conditions of poverty for a variety of different reasons. And we've also experienced as a nation a great deal of civil unrest since late May due to the killing of George Floyd at the hands of police. And so we are at a moment where where many of us are seeing these sorts of events unfold in real time. And because of COVID and the fact that a lot of folks are home and able to be, seeing what's actually occurring in real time, it is like a moment of national reflection on these issues, right? And so we feel like this is a time that getting more information about what systems of care in particular might be needing is important, but also we have, since late May, our team has received, I would say, like an uptick in requests for technical assistance, particularly related to racial equity and, health equity in general. And so that's just anecdotal based on what we're, kind of just responding to. And we're creating a small report to kind of get a sense and compare. But I think it's important to note that, a lot of organizations around the country, and particularly systems of care and mental health systems and other public sector systems, are seeking focused information in these areas. And so I'm hoping that the environmental scan will help us to, as I said, better identify what some of these needs are. With regards to the presentation of these findings, and this slide is the first one, I'm not presenting the whole environmental scan. I'm just going to present a few questions with responses that we got. We actually sent out this scan over the course of, we started in August 2019 and then again in March 20th. I think we started the piloting in August. And we really didn't launch this in a really focused way, but we got 9 responses to date. We really wanted to kind of look at the questions, make sure they made sense to folks, and that they weren't too much for folks to respond to in a 15 to 20 minute response interval. But we've gotten 9 responses to date, and I wanted to present some of the findings. The findings that I'm talking about are going to be really specific to those things that organizations are doing. The questions have to do with broader infrastructural types of things that organizations can do, either regarding, mission, vision, governance, policies, funding, that sort of thing, so that we can start to move the thinking and discourse or discussion with regards to cultural and linguistic competence from training folks, which is, as I said, important, but really looking at broader strategies that line up with the national class standards and also are more focused on organizational implementation strategies that organizations and systems can undertake in order to then track these using data. So the first slide here, as you can see, the question is with regard to vision and commitment to cultural linguistic competence. We asked, which of the following has your system of care produced with regards to these, documents that show a commitment to CLC, either with regards to a CLC plan or other documents that might be more in the area of strategic planning. Some folks introduce language about equity in their mission statements, right? So we had 8 respondents indicate, the majority of respondents, and this is actually a question you'll see there's a total of 25. Where you see more than 9 responses, people were asked to check off as many as applied. So we know that 8 respondents indicated that they do have a cultural linguistic competence plan, which is kind of like a strategic plan, but very much focused on CLC efforts and health equity efforts in this system of care. We then had 7 who indicated that there were specific policies related to the diversity of staff, culturally and linguistic competence service delivery that adheres to the national class standards, and or language that focuses on, very specifically articulates family and youth voice or leadership as part of the documentation of these values. We then saw that 5 had explicit reference to culture, cultural responsiveness, and or cultural and linguistic competence in the mission and vision statements in particular. And then 3 respondents indicated that there were other documents in place that were, that could be annual reports, logic models. I'm trying to think of another example, but basically other documents that are used, official documents for the system that outline or indicate that cultural and linguistic competence or health equity are a focus and a priority. And then one respondent who said that they plan to develop documents. Well, this was an interesting comment. I also have some of the comments here, so I'll read this one. One respondent said, leadership like to believe that they're creating a CLC vision. There's no real insight into the barriers, the real barriers to access that families, youth, and other clients face. The whole team isn't diverse and is unclear about how to develop a welcoming environment. So there are some responses like that. So we get a broad range where we see here, if we look at, the fact that folks could choose multiple responses, we know that the majority of systems of care, and they have done this as part of, requirements in the past for the grant, are at least using CLC plans, right, and developing a plan usually based on their behavioral health disparities impact statements. And that's one of the key ways that we've worked with a lot of systems and organizations. But we can see that there are other concerted efforts, which is very heartening to hear about efforts to really document this value, and it's a system of care value, cultural linguistic competence. So it's good to see that there are these efforts undergoing. I wanted to ask Selena or Catalina if they had any questions or input that they wanted to add before I go on to the next slide. No, okay. We'll just take a head nod. So the next question was pretty straightforward. Does your system of care have a dedicated full-time staff member or other position to promote, lead, or address your cultural linguistic competence objectives? We had just about half and half, right? This table says, 4 folks did and 5 did not. And that can be a function of the fact that this requirement used to be a formal requirement of grantees and now is not. And as grantees, shift from being grantees to sustainability, perhaps without grant funding, sometimes the funding does end for that position. We have worked with states and localities that have indeed sustained these positions. And takes a great deal of effort, but they've done it, so we know that it happens. But we can see it's sort of half and half. And I think there are arguments on both sides for having someone that's very specifically focused on behavioral health equity and CLC as their main, work responsibility. And then there are arguments for not doing that. But I think that when you have somebody that's really tasked with that sort of work, then that becomes a formal function of your organization or your system. So the next question was, does your system of care use any of the following committees to promote, lead, or address cultural and linguistic competence practices? And again, it was please check all that apply. And so the majority of folks, 6 respondents, said that they use a CLC committee. And we know that that's also just like the CLC plan, that's something that is very much used by system of care communities to help in the development of the plan and then overseeing that that plan is implemented. 4 respondents indicated that they used a community advisory board, so that they actively work to engage folks in their community, particularly those that represent their service use population, and then have those folks serve as a community advisory board. 3 respondents said that they use a governance board structure to actually promote, lead, or address CLC practices. And for this question, I don't have additional information on how they use that governance board. Some folks will have a CLC lead sit on that advisory board, and then have, for organizations that have policies in particular and where CLC or health equity is part of their mission and, vision and value statements, that having governance involved helps to implement practices and strategies that reflect those values. Another 3 respondents indicated that they use an evaluation committee to review CLC practices and the implementation of those, which is good to hear. That means that, not just we're trying to implement these practices, but we're also trying to track how well these practices work, right, which is important also for implementation. And then one respondent clarified, which may be the same respondent from the other question, that there was not a huge commitment to CLC yet in terms of even developing a committee or a plan. So, so while that is, unfortunate, I guess, to say, I think it's good to get those sorts of responses to kind of show us what the range is again, and also where folks to track sort of the needs at the end of the questionnaire, which I won't be going into later. But it gives us a sense of where folks are starting from. I don't also have this a crosstab here that shows us respondents versus whether they're new or established or former grantees, because we did send it out to a range of folks, so that can also be why there is that distinction there. So does your CLC lead have decision-making authority or direct input into these categories here, which include organizational policy development, budgets, CQI processes, and other? And as you'll see, no respondents had a CLC lead that has input into budget any kind of authority into budgets, which I think is pretty typical, and is interesting, I think, compared to one of the next questions. Really, it shows that even though that's the case, there is some budgeting that goes on to support CLC practice. So it's interesting, but it's something that I know that Selena and I, when we've worked with system of care states and localities, particularly on on-site technical assistance, that this is one of the areas that we've worked on and that folks are very much interested in how to do this and how to, do this in a way that that makes sense for organizations and systems, given all of the things they have to keep in mind. But there is here, the majority of folks said that the CLC Lead participates in some regard to policy development, which is heartening also to see. And I think that's another area where we've really worked with organizations to really think about broader policies and how those policies reflect the work of CLC and health equity. CQI, not so many, right? But CQI is another area where, just like the evaluation committee, where if you're implementing practices, it would be good to track how well those practices are working, right? And how staff is responding to those practices and the people that you serve are responding to those practices. And let me see if that comment, I don't think we have, okay. No, the one comment was basically that we try to support all aspects without real, focus on any CLC type of information. So this is the slide on budgeting that I referenced. And does your system of care have a budget line item for CLC planning? And 6 of 9 organizations said that they did, which was, I think, surprising. It was surprising to me. I don't know if Selena and Catalina were surprised by this response, but it was also heartening because, as I said, we have been working in this area with folks, and I think that, there's a clear understanding that if you're going to be able to implement practices, that it takes funds to do so. There's a whole lot of things that go into implementation, even of an intervention, that have to be minded at various levels of your organization or system infrastructure. So this was a good response to see. And then what specific population groups has your system of care identified as priorities for programs and services? So the 8 respondents said sexual orientation in particular. And I apologize, I'm not quite sure how we listed in the questionnaire at this point, whether it was open or whether we actually divided sexual orientation and gender expression, but we'll double check that. Sexual orientation had among the most responses, as did race. That was followed by 5 respondents who said that they focused on ethnicity, with 1 respondent saying that they really were focused on Latinx populations and 1 respondent saying Hispanic. And these may be different, populations actually. And then 5 respondents referred to geographic area as a population group. A lot of times that has to do with rural versus urban and suburban, if I remember correctly, right? And as well as tribal communities, right? It's listed there. And then 4 respondents indicated that they had specific priorities related to ages in the service use population. And we know that particular age groups face disparities at different stages. 3 respondents indicated that other groups, including military families, 1 specified deaf and hard of hearing populations, and 1 again specified disability. So this does show that there is a broad range of populations being considered, which is in keeping with this broader notion of what constitutes a cultural group or population. One respondent indicated that their system of care hadn't yet identified specific populations. So I suspect that that one respondent was a newer grantee and they were getting up to speed on some of these activities. Please identify any social factors that have been identified as priorities to be addressed through your system of care. So these have to do with priorities related to CLC or behavioral health equity. And again, it was one of these where we checked all that applied. So the social factors that were most checked off were cultural beliefs about behavioral health and wellness. And those are often tied to racial and ethnic groups, right? We also saw 5 respondents indicated that language accessibility was one of the priority areas that they're focused on. And then I think those were followed by low education, low literacy, and poverty and income barriers. And then as you'll see here, housing. Housing, those factors, poverty and income barriers, housing, they really speak to the root causes, as I was saying at the beginning, with regards to social determinants. And the fact that, certain populations are going to experience these conditions and thus experience a broader range of disparities, unfortunately. So I think these are important to note because they really show that these communities were really thinking about the broad range of factors that go into disparities. And we have a couple of questions in the chat box. So I'll touch on those in just a bit. This question is one I know that we've worked with, particularly Selena has, with quite a few communities around the country. With respect to human resources, please check any initiatives your system of care uses to mentor, recruit, and retain diverse staff or staff from diverse communities, particularly, again, from service use communities. And the majority of folks said that they rely on anti-discrimination workplace harassment policies that are already in place and they are implemented, which is great, right? It's great that you have these policies and that they're being used. I think we wanted to get a sense more of any particular other practices that are being used in this regard, right? And so the next most often responded or clicked response was job openings advertised at sites that reach diverse communities. And so I was happy to see that because I know that I have been on multiple calls and presentations that Selena has done, and that this is a key area and strategy that has been used, that has been recommended to a number of different communities. So it's really great to see some of these strategies being put into place. That was followed by interview guides that include CLC-related questions. So 4 out of 9 respondents said that they use those. And that, signals that there's real thought going into the recruitment process in this regard. So that this is a real effort on the part of not just frontline staff, right, to address the needs of diverse communities, but also at various levels of the organization. And then the next one I'll point out was partnerships with racially and ethnically diverse institutions by 3. I'm going to see if I have one more here, I think, and then in the interest of time, allow for Selena to present. Which of the following training topics have been delivered within your system of care? So we talked about, I know I mentioned training quite a bit, and partly when we look at one of the areas of research that really interests me is looking at cultural and linguistic competence as a concept, how it's operationalized, and how it's been implemented. And oftentimes, as I had mentioned before, it has been through training that it's been implemented. And training is great, I think, but it only goes so far, right, without these other strategies that we were talking about. But as you can see, this is where we get sort of the most traction, where we know that system of care communities are doing training. They're doing lots of different training, very diverse topics that they're focused on. And, you know, we got a total of 47 response from 9 respondents. So people were using a lot of these. The ones that were most often cited are the National Class Standards, followed by CLC and wraparound. So really an interest, and we continue to see this, where there's real interest on the part of folks that are implementing wraparound as a practice on being mindful of cultural and linguistic competence on the part of wraparound teams, but also on understanding the community conditions that folks that are using or being served by wraparound teams face, and how that may affect their sort of, you know, response to these services. That's followed by implicit bias training and cultural terms and definitions. So I wanted to just stop for a moment and check and see where we are with regards to questions. We had one comment here that said, yes, ongoing community boards are keeping communities together, talking about community needs and concerns, even with Zoom. Do you know of any town halls for the community to participate in to express their concerns positively but safely about their health? So I'm going to open that question up to my fellow team members here. And this was a question from Amy Davis. Are you looking for town halls in a particular region? That would be the first as Catalina's question, but also in terms of health generally, behavioral health, COVID, could you give us a little bit more information? And we can, I don't know of any town halls off the top of my head, but I think we could help you find some for folks.
I was just going to mention that one thing that I'm noticing is that many communities are leading listening sessions or community listening circles, and they're partnering with ethnic community-based organizations such as, you know, the National Association for the Advancement of Colored People. They're partnering with academic institutions, different grassroots organizations, and so if there aren't, you know, existing town hall meetings, maybe this is an opportunity to partner with some of your, you know, racially and ethnically diverse organizations and host some community listening circles around racial inequities and other inequities as well.
Thanks, Lee. I think that's an important point, and that that systems of care, I just would add, are actually great, often play a role as facilitators within their communities, right, as a facilitating body that brings together multiple organizations. And so where there may not be, as Selena was saying, town halls, you may want to initiate a small listening circle first, and kind of think about whether you might have a committee, a community advisory committee that can help you in doing that, and also to reach out to these organizations that Selena mentioned.
And then there was another question. Are parents involved in these communities? And I think the person asking the question was asking about the respondents to the environmental scan.
Without looking at the full range of responses, I can't say 100% yes, but I would venture to say that they are to some degree, given the fact that these were, you know, like I said, we had a range of respondents, and communities that responded. We had some former grantees that had been, long-standing grantees, and then others that were just starting. And so given that, family and youth voice is another one of the hallmark values and principles of systems of care, I want to say that, yes, they were involved to some degree, but I don't have that specific data in front of me for this. But we can definitely share that with you. One of the things that that I'm hoping is that we can continue to administer or make this this scan available to folks so that they can respond to it and give us a better, more accurate picture. And we would probably be doing that through our learning community and or through email. Email sometimes, is, we all are inundated with emails. But for those that are interested, I think that even answering these questions for yourselves may give you a sense of where, what you're doing, where, and what are some areas that you might still need some support in. And that was really the underlying reason for doing the scan, because then that would tell us where we might need to, focus our efforts more with folks and communities. I think we have another question. Thank you. Oh, this is, I think, more clarification from Amy. Thank you. Specifically regarding stress in reaching services to meet their needs for mental health, dental, financial strains, inability to reach persons at programs who are not fully back to work. Yeah, I think I would emphasize or highlight, underscore Selena's point about reaching out to other organizations in the community that are working in this area to not just sort of increase access, but increase knowledge about disparities on related to COVID in particular on a broader basis, and trying to see if maybe if you can't find anything like that in your area, that that your system of care might be instrumental in starting just some learning communities where folks can, not learning communities, listening circles where folks can share some of this information and possibly help you to figure out what are some next steps in that regard.
And one resource that was suggested in our chat box was was the Parent Training Information Centers, and the link is in the question and answer. The parent centers have that serve families with children with disabilities are holding session groups about person-first language, and this could also be another potential source for listening circles and or support during this time.
Thank you. And that was shared by Allie Walford,
yes,
Florida. Thanks, Allie. Are there any other questions or comments to what we presented? I'm hoping that folks will be, if they see a request come through or through our learning community, see an announcement for the environmental scan, that they'll consider taking it and helping us to kind of get a sense of where we are, a better picture in terms of these practices and strategies. And so if there aren't any more questions, we'll just wait another minute or so to see if anything else comes through the chat. I can turn the discussion over to Selena, who's going to talk about some resources.
Before Selena starts, I just wanted, for those that don't know how to use the Q&A, at the bottom of your screen, you should have like a toolbox that has your microphone icon and your video icon. To the right of that, right before the big red circle, there's 3 dots that say more options. If you click on there, you can click on Q&A, and then it opens a Q&A panel on your right. All right, Selena.
Thank you, Linda. All right, I'm going to go ahead and share my screen. Chelsea, can you help me with that?
That should work.
Yeah, I think I have too many screens open. Let me go here. All right, okay, here we go. All right, thank you so much, Linda, for covering the environmental scan. And as Linda mentioned, we are all living through COVID-19 and also the second pandemic, as we call it, of civil unrest. And so many of our communities are mourning during this time, not only about loss and death related to COVID-19, but also around racial stress and trauma associated with the civil unrest. And so in recent weeks, we've had several technical assistance requests about facilitating racial equity conversations with communities externally, but also how to facilitate those conversations internally. And so, I think it's really important for organizational leaders to assess their internal organizational climate around racial equity. So I'd like to share a few tools with you. This is the first tool, and this tool was developed by the National Council of Behavioral Health, and it's called the TROT Climate of Equity Assessment. TROT stands for Trauma Informed Resilience Oriented.
Rena, I'm so sorry. We're actually not seeing your screen. We're seeing gray. So what I think happened is when you selected share content, you chose a particular application, and but now you're showing us something that's not in that application. Yeah, so we see the internet, but we don't see any of the others. So if you go back to your WebEx and hit the share content button once again, you can either choose to share your whole screen or just share the application that you'll be showing us.
Okay, sorry about that. Let me try again. All right, well, I just talk through the resources and then we'll send them out later.
Absolutely. Everything works.
Okay, all right. So I'm going to get off of sharing screen because I'm sharing too much stuff here. But I'm just going to talk through the resources and then we'll send them out later. I apologize for the technical difficulties there. All right. Can you see me now?
Okay,
all right, I'll just keep going. All right. So one of the resources that we like to highlight is the Trauma-Informed Resilience-Oriented Care Climate of Equity Assessment. And this assessment was created by the National Council of Behavioral Health, and it's to assist organizations in understanding their climate around diversity, equity, and inclusion practices. And so the assessment is a Likert scale, and it includes statements that your staff, your team will respond to. And some examples of those statements are, my culture is respected here, or my voice is heard as equal. Communities of color are involved in decisions that impact them directly. So, so those are just some examples of the type of statements that staff or leaders or individuals who are within your behavioral health organization would respond to. And then there's a second section that allows for more qualitative responses. And those questions are, what do we need to keep doing? What do we need to change? And then what do we need to start doing? So there's an opportunity for staff internally to provide some input around equity practices of the behavioral health organization. And so this tool can easily be used with Qualtrics or with SurveyMonkey. It's really user-friendly, and the results of the tool, of the survey, of the assessment, could be used in terms of prioritizing specific strategies that the organization may use in addressing equity issues. All right, so the second tool, any questions about that particular tool? All right, so the second tool is a protocol for culturally responsive organizations. And so in our TA request, some of the organizations have stated, as Linda mentioned, that they want to move beyond just training and professional learning sessions and that kind of thing. They want to do deeper and more impactful work in terms of advancing equity within their organizations and even in larger communities. And so this protocol for culturally responsive organizations, which was developed by the Center to Advance Racial Equity at Portland State University, is an example of a tool that could be used in terms of assessing equity within your organization. It's a very comprehensive document. It addresses equity across several domains. Many of those domains align with the national class standards. For example, commitment, governance, and leadership. The organizational climate, culture, and communications, that's another domain. Service-based equity, so how do you address adaptations in a way that you deliver services to children, youth, and families. Voice and influence, so who is contributing to the decision-making process? Do you have representation on your governance structure? Those kinds of things. Workforce composition and quality, community collaboration, the example that we just mentioned in terms of the listening circles, working with multicultural organizations in terms of understanding what's really happening in the community, perceptions of the community, history of the community in working with behavioral health organizations. And then, of course, data metrics and quality improvement. So these are the domains that this particular tool covers. And the scale is really interesting because it really forces organizations to think about where are you in the process of these different domains. So not yet thinking about it, thinking about this, assessing this feature in our work, initial improvement effort, entrenched, so meaning that you're doing the deep work of addressing that particular issue. So this is just one example of a document that or an assessment that could be used in addressing, in assessing equity within your organization. Any questions about that particular tool? All right, and then the last tool is entitled Evaluation of the National Class Standards, Tips, and Resources. This particular tool was developed by the Office of Minority Health. It's very comprehensive in terms of evaluating and developing metrics around the class standards. So we all know that the class standards were developed by the Office of Minority Health. They were enhanced in 2013. They are a foundational framework in terms of addressing equity and eliminating health disparities. And so this particular document offers 7 steps for implementing the national class standards. There's a chapter on evaluating the class standards, so specific ways that you can measure, so indicators and metrics for the class standards. And then the final chapter offers relevant resources and data sources that you can use in terms of tracking and monitoring health data. There's an appendix that includes examples from a perspective of an outpatient setting to a behavioral health setting, a hospital setting, as well as a public health setting. So this is a great document if you've done the initial engagement of educating your community about the class standards, and now you're ready to move into, okay, how do we actually operationalize these standards in our work, from the governance and leadership perspective to the communications and language access perspective, and then on to community engagement, continuous quality improvement, and then, of course, data collection, monitoring, and evaluation. So these are examples of 3 tools, and, we also have the learning community that has several webinars and other resources to assist you on this continued journey of advancing racial equity in our communities, as well as addressing anti-oppression of other cultural dimensions as well, from classism to sexual orientation, gender identity issues as well. So we're here as a resource, and thank you. Are there any questions about the resources I highlighted? And again, I apologize for being my screen sharing ordeal. But we will make sure that we send those out to you. Were there any questions in the chat box?
I don't see any questions.
Okay.
If there are questions, it always takes me a minute to digest information and then think about questions. So if you do have questions as we move forward, do put them in the chat, and we'll get to them at the end. So I will now pass it on to Catalina, who has some announcements and other discussion items.
Okay, thank you. And one thing that you can share with us in the chat box, if you'd like, is a couple things. First is, what is the biggest challenge that you currently face in moving the work of advancing health equity forward in this time of COVID, as well as this time of social unrest? So if there's something that you want to share, put it in your comment box. We're gathering that so that we can get a better sense of where people are and what additional resources we might be able to provide to you. And so we move on to the announcements. It may be a surprise to some of you, but this will be the last, yesterday was our last peer learning exchange webinar for the National, the Technical Assistance Network CLC learning community. And that means that today is our last meeting as a roundtable. Originally, the roundtable started as a group of about 20 CLC and behavioral health equity practitioners, mostly CLC coordinators or social marketing coordinators, and has grown tremendously since that, because it's been such an important work. But because the NTAC contract ends on September 7th, all our work that we have accumulated in terms of resources and webinars is already online and will continue to be available online. So for those that haven't used it, I wanted to navigate it for you, and am I able to share my screen, Chelsea?
Yes, you should be able to.
Okay. So the University of Maryland hosts the learning community through a platform called the Ideas. And we will send out the link, and Michelle has already put it in the chat box previously. So when you go to that link, it pulls you up here. If you are a member of the learning community, or of any of the learning communities, you can go ahead and log in. But even if you're not a member, you can go to the catalog. You can go under cultural and linguistic competence. We have we have a series of courses, and one of them that I think is most relevant, would be relevant right now, is addressing racism as a social determinant of health and well-being. We have a series of webinars that are introduction to cultural competence. Another one is we have a series of webinars on the class standards. So that's one way. And these webinars and resources that you see here will continue to exist and be available. Anything new that is created after September 7th will, sorry, I didn't mean to share that, will be available at a cost. But everything that's on there now will continue to be free. All right. So that's just a screenshot of what I just showed you.
Catalina?
Yes, ma'am.
I'm so sorry. We're just getting some feedback from your headphones. I don't know if you're able to adjust from using them or not.
Okay, I'll try. Let's see what the kids do. Yeah, I don't.
We can hear you.
Oh, there we go. Okay, it takes a while for it to disconnect. It takes a while for it to disconnect. So this is just a screenshot of what I showed you when this information will be available to everyone. We will continue to be available if there are questions that we can answer, and we can direct you to the new technical assistance resources and in our life outside of the learning community and the TA network. We can also assist you and will direct you to resources that the University of Maryland has set up. But we want to continue fostering a sense of community. And I think, Linda, were you going to share a link to the environmental scan that people can take, or how do you want to share that?
Yeah, well, probably, I don't have the link handy. I think we can share it as part of the resources that go out to everyone that attended, as well as we'll probably list it as an announcement on the learning community for the next month or so, while it's still in full operation. And like I said, we can email it out, but I get about 100 emails a day. I don't know about everybody else, so it's easy to kind of lose track of emails. So if anyone has, if anyone is really eager to take the scan, just let us know in the chat box also, and we'll make sure that it gets to you individually.
Do we have any other questions or comments that anybody wants to add? And again, you're going to receive an email with the slides and with the material and with a recording of the information. It'll go out to everyone who participated, as well as those that registered but couldn't attend. And we're also hopeful that that email will include a link for you to submit your information to us if you want to continue, if you want to be listed in a directory of health equity practitioners or people interested in learning more about that topic. And we're still trying to figure out the best way to create that. So I think what we're going to do is create a link and include that so that you can submit your information. What we've found in the last few weeks is that, in the last few months, is that a lot of people are looking for mentoring. We have a lot of systems of care grantees or people who finished the grant who are experienced in the work of CLC and health equity, who are willing to help newer folks that have just come on as CLC coordinators or are part of a new grant begin this work, especially when it comes to creating plans and drafts. And so we want to be able to share the wealth of information and the wealth of resources that have been gathered over the life of the NTAC grant.
Yeah. If I could, I would just, the only additional thing that I would say is that we also maintain the Cultural and Linguistic Competence Library of resources that we can also include, that has a variety of really applied resources for that are focused on behavioral health and a lot of the strategies that we've talked about here, and houses a lot of the resources that we have shared in our time providing technical assistance to systems of care. So we'll also make sure to make that link available to you all. And
I just put it on the chat box, but we'll include it in the email as well.
Yeah, thank you. So I guess we'll just wait another minute to see if there are any other questions or comments. And if not, I'll leave it to Catalina to close out.
I think we want to remain available to everyone. This has been a great time, not this particular last few months, but the whole process of the TA network to connect with folks that are advancing the work of behavioral health equity. And it has been a pleasure to work with many of you personally or over these webinars, and we hope that we can continue to be a resource for you in whatever way you need it.
Yeah, and we're happy to just stay on a little bit for folks that do want to chat individually. Sometimes on office hours, and you know, folks have individual questions that they want to follow up on with a technical assistance call. So we're happy to do that. And I don't know if you had any parting words, Selena.
I just said it's been a pleasure working with behavioral health partners and teams, and that we're here to support you. And we wish you well wishes in your continued work, and don't be discouraged, and keep up the fight.
All right, everyone. Thank you. Chelsea has made a note to everyone that a certificate of attendance will be included in the follow-up email from the webinar. So thank you very much. I think this concludes, you know, our portion. And thanks for joining us. Someone has asked how long we'll stay on. We can stay on as long as you need. If you have a question, or it's a question from Andre Williams. I don't know if you're still on, but we're here. And you can send a private chat if you'd like through, there's a way to send chat directly to the panelists and or individuals that you have a question for. And or feel free to send us an email, and then we can schedule a call with you if that's easier. So maybe we'll just stay on a few more minutes just to allow for folks to raise any questions.
I just put my email on there in case anyone needed to contact us. I can be the point person. If you want to schedule a follow-up call or have any additional questions before you get the follow-up email, I just included my email.
Okay.
Oh, I'm sorry. I just did that to all panelists. Let me do it. That doesn't help many. You all know my email.
So yeah, as a professor, sometimes, you know, we just open our offices. We have to be in our offices at a certain time for people to drop by and ask questions. So feel free.